Once again, I got a podcast. We're back with it's Speaking with Gravity, and I'm Curvin, your host. I say once again because sometimes it's still surreal to me that I have a podcast, but it is what it is. On this podcast, we talk about mental health and how everything affects everything. As your host, what I want you to know about me is that I'm a son, a brother, a husband, a father, a friend who happens to be a therapist. You see, when you sit with a therapist, the conversation is different. With every episode, the goal is to have a conversation that make you think, make you feel, make you do what is best for you.
Yeah.
I'm a therapist, but this isn't therapy. It's a podcast.
Swank.
Today, I have another guest with me, another dope therapist, another dope person, a close colleague, someone that I go to talk to and get ideas from. Love talking with her. It's almost like I'm learning, even though I believe I graduated before she did, but I'm still learning whenever I'm engaging with in a conversation with her about psychology or about therapy in general. Today we have with us Miss Dee Carpenter, and I'm gonna give her the floor so she can introduce herself better than I just did.
Good morning, everyone. Thank you, Kervin, so much for the opportunity to be here. I'm just ecstatic to have this conversation and open dialogue with you. I'm so proud of your movement and what you're doing. I think it's important that you're representing us as Black therapists, and I just appreciate you utilizing your platform in this magnitude. Um, I think you simplified it. I'm Dee Carpenter. I'm a mother. I'm an educator. I'm a learner. And I am your Black therapist. And I'm excited to be here.
So right now, how are you moving? You just doing therapy alone, or what is
Um,
your role right now?
well, right now, my primary role is an educator. I've kind of taken a step back temporarily for therapy due to some personal avenues, but definitely still looking to, advance myself educationally, and still looking to raise awareness about the need for therapy. And so looking to bounce back in 2021, looking to go back into the avenue.
So when you say need for therapy, and we're gonna get into our topic here in a second, but when you say need for therapy, who are you talking about? Are you talking about the community? Or are you talking about a particular group of people? What do you mean by need for therapy?
Mainly when I talk about need for therapy, I'm talking about the community as a whole, specifically to our African American community, who is a near and dear population for me. I think the presentation and understanding of what therapy is um, could solidify us in a way that we're not currently solidified. So I'm speaking in general. I think therapy can benefit each and every person, but specifically targeting that population and even in detriment to, African American women, children, just that population in general.
Yeah,
Yeah.
I'm with you. I'm definitely with you. So today, speaking of therapy and the population as a whole, African American community, one of the things that I've seen a lot on social media, more, I don't, I feel like I've seen it more within the last year or two. Depression. People
True.
throw around depression. They throw around that word anxiety. I also see bipolar thrown
Thrown
around
around,
a lot. But today I wanted to focus on depression as a whole, just talking about what it is, the symptoms associated with it. I also wanted to talk about the different types that we can have, and then what to do about it. So
Okay.
those are the three key points that we just gotta kind of stay close to, because me and you, when we're talking, we can kind of get
Navigate.
we can go all over the place with it. But let's begin with what is depression, in your own words. I guess before I give you the floor, I recently saw where it says the excessive absence of enjoyment. I
Okay.
had not seen it
Yeah.
written out like that before. I
Okay.
really like that, but just expound on what depression is.
I definitely love that definition.
Yeah.
I think when I look at depression, I think it's the direct interference of a person's daily functionality. When you're looking at how a person is able to, just move forward in a positive mind frame. And I think just what it says, the absence of, enjoyment, the absence of fulfillment and purpose and things, I think are ultimately some key factors in experiencing depression. Um, for me, it's just that functionality portion. I can't seem to escape that. So that,
And I love how you said fulfillment and purpose. Again, I'm a therapist, so sometimes this comes across in therapy, but a question I often have is, what do you want to do?
yeah,
What do you want to be when you grow up?
yeah,
When you cannot answer that question, that's a cause of concern for me. That does not mean you have depression,
depression.
just because you
Right,
can't
right,
answer that question, but that's a cause of concern. Everybody has a purpose. Everybody has a sense of fulfillment. They have things that they like to do, they want to do. And when a person isn't aware of that, I'm
right.
concerned. So, what are the symptoms of depression?
Daily, I think when you're just looking at it, I think the lack of energy. You're looking at, inability to get up out of your bed. The loss of enjoyment of things that you typically, recently may have enjoyed or been engaged with. Isolation. The fear or lack of desire to be around other people. I often see it when we're looking at it from a cultural standpoint. I think it's the avoidance of, people who know what's best. Is typically a significant sign of that. Weight loss, weight gain. I think it's just depending on that individual person's needs, or what they may be experiencing. And I think it's just, a sense of how we have generalized or capitalized how we respond to certain experiences that we encounter. And so depression for a person looks different.
Yes,
And so
absolutely.
I think that's the magnitude of it is depression isn't the same for people. And I think a lot of times when people, and visualize depression, you're thinking about somebody that, doesn't want to get out of bed, or, wants to stay in a dark room all the time, or maybe just wants to spend 2 or 3 hours in the shower. And that's not always what depression looks like. There's such things as functional depression. So, you can be very functional in your day and still be depressed. It just looks different for each and every person. And I think that's where, we kind of talk about this often is you having that self-awareness of when something about yourself isn't right. Other people may not recognize it, but within yourself when something isn't right with you, and when you may be experiencing since different
I like
depression.
when you said isolation,
Hmm.
because isolation is not just staying in my room
Hmm.
all day. I like how you said also it's different for different people. Um, I I equate isolation to social withdrawal.
Draw.
Just you know, you hear sometimes I don't like people. I don't want to be around people. And another key point that you said, the avoidance of certain people. You know, this person is going to ask me this question. This person is so happy. And I just don't want to be
Around
around
that.
these type people because they're going to force me to not. They're not trying to force me, but I feel like I have to do this and do that when I'm with this group of people around these group of people. Also, anger,
Yeah, the
irritability.
ability. Yeah.
Uh, that's another few symptoms that comes along with it, and it may be because you're being forced to leave the home and engage in some activities that you just rather just not be involved with. So symptoms, all these symptoms that me and you talking about, somebody feel all of those symptoms. Does that mean they absolutely have depression? If they just have one or
One or
two
two.
of those, does that mean they have depression?
I think no. I think that's where you really have to seek. That's the importance of seeking, assistance and support when looking for a diagnosis. I think people have to be very careful about labeling themselves as something. Depression is real, but it's also important that you don't label yourself something so that you don't become it. We talk about self-fulfilling prophecy all the time. We learn about that people, when they have an expectation of something or that's what they think they are, that's what they start to fulfill, and that's what they start to become. And so easily, when you attach a label to yourself, you can make yourself sick. We talk about that. You can make yourself depressed, by just taking on that label. I think just because you're experiencing symptoms, I think it's important, again, to go back to that self-awareness, is to know and acknowledge when there's an alter in that and you're starting to experience that, so that you can successfully explore other avenues and see what may be occurring for you. Does not necessarily mean you're depressed, but it does mean that at some point your mental health is being impacted when you start experiencing those symptoms. And I think it's important for people to understand that every person has mental health. It is not that mental health is an isolated experience. Every person in this world has a mental health, and every experience that you encounter can impact your mental health, and an impaction to your mental health can lead to depression. So you're just looking at those avenues of how things come to play.
I love how you broke that down. That the way that your mental health is impacted can lead to depression.
Right.
You said earlier about functional depression.
Right.
So elaborate on that functional depression, and I guess tie in the whole mental health impact. As you're saying it, again, because I'm a therapist,
Just
I think I always start off every episode saying everything affects everything.
everything, right?
We have the political climate that we're in. We have COVID-19.
2020.
We're being told to stay away from other human beings, which that's the very essence of us as human beings. We have to have that social connection. My social connection may be different from yours. I might need 20 people, 30 people, whereas you
Right.
only need 5 or 10, but you still need your amount, I still need my amount, and we're being told to separate. So all of that can affect my mental health, and then therefore lead to depression and functional depression. Just what is functional depression? And, as we throwing out that phrase.
When I'm speaking in reference to functional depression, I think about an individual that is still able to go to work daily, still able to socially engage around people. And even when we go back to speaking earlier about isolation, you mentioned social isolation. I think about mental isolation, and I always ask people, have you ever been in a room full of people and still feel alone? And oftentimes when you ask people that question, they be like, yeah. Or you see people who have big families, but they like, I just don't fit in. You know what I'm saying? They always see themselves as the black sheep of their family. So when we're talking about that functionalness, you're still able to be around people, you're still able to go to work, you're still able to get things, but it's just something within yourself that you just feel is not present. You're not your best person. And then you have other functionals where people who constantly are trying to be better. They've already achieved such a level of success, but they're still always streaming, or they're not able to embrace where they are. It's always striving for something greater. You know what? And that can be a good thing. You know what I'm saying? You're not always looking at it as a weakness, but sometimes that's a person's technique and practice to escape the reality of what's really going on for them. And so when I talk of a functional person, experiencing depression, that's what I'm kind of looking at, because ultimately, although you're achieving so much, you're still not happy with yourself. You're still not good enough for yourself, and that is a key component of symptom I think are associated with depression.
And when you're saying functional depression, you're not giving that as an actual diagnosis.
No.
That hasn't been determined.
That hasn't been determined.
To my knowledge.
No, it's not.
But speaking of that, what are actual types of depression? Or is it just one big thing?
Depression is a magnitude of different things. I think when you hear that word so commonly, that people have kind of normalized it, and I think it's important to kind of normalize this experience. But there are different types of depression. You have, for pregnant women, you have postpartum depression. You have major depressive disorder. You have bipolar depressive disorder. You have for children, acute adjustment disorder. You have different things that can kind of lead up to, and that's just to name a few. That's not in any way to post-traumatic stress, acute post-traumatic stress. You have all of these different things, and then you have disorders that are a combination of things. So there's not just one form of depression. That's the other magnitude of things. You have depressions that are drug induced. So there you just have to be conscious and aware of factors that may contribute to the symptoms that you're experiencing. So no, in terms of what depression is, I think I don't know if you've looked at the DSM-5. A lot of people don't know that, but that's the list is endless,
It's endless, man.
and
It's
it
so much on
overlaps.
it. Yeah.
When we're talking about symptoms, when we're talking about diagnosis, and I know for me as a therapist, I don't like to give anybody a diagnosis of depression. I don't like to give anybody a diagnosis of anything because until we've kind of gotten deeper in and we're kind of revealing things, because sometimes people just haven't had the opportunity to really express what's on their minds. And that can lead to a distortion of your cognitive, which may make you feel like you have depression or you may have this. And again, I don't like to put that label on people, but it's a reality for a lot of people.
Again, I try to stay focused here, but even when you say that, it is important not to necessarily just give a diagnosis after the first session.
Mm-hmm.
Sometimes I have a feeling when I'm talking to somebody that they may be this
Mm-hmm.
based off of my past experiences, based off of the things that I've studied. But then when you start listening to them over time, you realize, okay, it's not that, it's actually this. And if you're not careful, if you just slapping a diagnosis on someone and then you give an intervention based off of what you originally put, it's not going to work.
Yes.
And it can lead them down a whole different path. But you also mentioned acute adjustment disorder when it comes down to kids. And I'm going to give you time to think because I'm coming with you at that one. The reason I say I'm coming because I don't have a full understanding of that one. And when I say I don't have a full understanding, that DSM-5 book is so big.
Yeah.
There's no way, well, I ain't going to say there's no way. Maybe it's possible to memorize the whole book. Maybe it's possible to know every single diagnosis in there, but I do not know it.
Me neither.
There are some that I'm more familiar with and some that I'm less familiar with. When it comes down to depression, I have worked with people with depression pretty extensively. I've never, I don't think I've given that I've given the adjustment disorder oftentimes in different situations, but just kind of explain what that adjustment disorder, acute adjustment disorder is with regards
and
to
I want to
depression.
correct myself because it is adjustment disorder. I think that's the key component of when you're talking so fast, but it is adjustment disorder. But when we're talking about adjustment disorder, we're talking about children that are having a difficult time with changes that may be occurring to them. So you're looking at experiences where different things can cause children to experience a change of adjustment. We're just thinking about our everyday lives. You know what I'm saying? For an example,
Okay.
A change in school could be an adjustment. A change in instructor could be an adjustment. A change in living arrangements, can be an adjustment because you just don't know, extensively how long that's going to impact that child. And so sometimes it can be something of a more minor magnitude, but other times it may be, something of a more difficult magnitude. So let's looking at aspects to that, a change in school may be a smaller, adjustment for a child versus a change in the home mechanism of where mom and dad were once together and are now separated. There's not a diagnosis for your parents being separated,
Right.
but the adjustment of having to maneuver the changes in dynamics of family now as a result of this separation is an adjustment for that child. And oftentimes, as parents or as adults, we don't always take into consideration how our decisions directly affect our children.
Exactly.
The children are kind of just told, this is what's happening to you. Get with it. But I'm looking at, you mentioned earlier COVID-19. Look at the adjustment or the demand or the pushback that people got when they were asked to put on a face mask. You know what I'm saying? Why? Because it was an adjustment to your everyday, and the uncomfortableness, we feel with it. Having to remember, grab my mask, having to remember, I can't go here, practicing social distance. That's an adjustment. And a lot of people were not able to comfortably do that. We've been in this, magnitude now for almost 6 months. and people are still struggling, over 6 months actually, and people are still struggling. So when we're looking at the magnitude of what adjustment is, it's that same magnitude, but it's a direct impact for children. Children are having to adjust as well to these drastic changes. A lot of children, may have even suffered with the change in going from traditional schooling to virtual schooling.
Yeah.
You know what I'm saying? That's a form of an adjustment, and so you may have noticed that your child's behaviors at home became different as a result of that. They struggle with, one, not having that social interaction, two, not having that direct, guidance and that direct contact, being able to ask questions. This technological form of learning is an adjustment for a lot of kids. So when we're talking about that, that's kind of simplified. It's so much more deeper than that. So I don't hope that anybody will say, well, she said because my child's not doing well they have an adjustment disorder. But it's just those are just kind of experiences or symptoms that may result or cause that type of.
Even as you're talking about that, it's funny because I was thinking when I said COVID-19, I'm only thinking about myself.
Right.
I'm thinking about maybe my family, and my kids are already homeschooled, so they're already virtually learning.
Mm-hmm.
But then when you think about it on a larger scale, kids' schedules are not the same.
Right.
When I went to school, it was period 1, 2, 3, lunchtime for an hour.
Right.
Then I go back to the next couple of periods, and now their lunchtime may not be an hour. They may not even change classrooms.
Yes.
And I say that because I don't know what the schedule is. But when I'm talking to kids in general, it seems like different schools are doing different things along the same lines, but all of them are different. And it affects us. It affects our social life. It affects just the change. Just saying that itself, just the change in general. People are resistant to change, period, anyway.
Right.
I think my sister sent me a text not too long ago that said COVID-19 patients, 20% of them are more likely to develop depression. I think that's the accurate number. But just, they actually went through an illness in addition to
Experiencing
all
these
the experiences of it as a whole. So the adjustment disorder, that's real big. Just the changes in our everyday life can cause us to can change our
moods, right?
It causes a change. It's bigger than just depression
right.
as a whole. That being said, though, so it's found in who? Adults, children, blacks, whites. Like, who is depression found in?
Depression is found in everyone, and I think that's the magnitude and the beauty of being able, or the magnitude or the beauty of having support and making sure that you're getting and asking the questions that needs to be. I think when we try to stereotype that only one set of person can be affected by depression, we allude and we exclude people from seeking the support that they need. I think you mentioned it earlier when we're talking about anger and irritability. That is so common in our African American men that is often overlooked as depression. There are a lot of African American men, when you actually talk to them, experiencing depression, but the way that we have been taught to respond to situations is it as a defense mechanism, right?
Yes.
You know what I'm saying? You're angry about stuff and you don't even, and that's the one thing that I always try to allude to, my son, even in this present state, is it's okay to be angry, but understand why you're angry, and then most importantly, understand your response. And take accountability for that response. And I think, I guess like I said, just kind of so that I don't go out too far. Depression can occur in anyone, but I think the most important element is to understand that it doesn't look the same for everyone. In terms of ethnicity, in terms of gender, and in terms of culture. Culturally, we handle depression differently. The response and our techniques of coping strategies are different, but they can be very similar. So there's no one face that fits all when you're looking at depression. It occurs in every presence, adults, children, adolescents, everyone.
It's important to know just to piggyback off of what you said, it's important to know why you're angry.
Right.
Anger is a healthy emotion when you know why
Why
you're
you're angry.
angry, when you know how your response because of anger is going to affect you and the others around you. Just that, having
That makes
control
sense.
over it like that, um, is better than just being angry.
Right.
And then the accountability part that you spoke on. You can't just be angry and then just blame
Like,
anger. You know,
right.
if you know why, and then you know I did it because I was angry, let's try to find coping
The
skills
seals, right.
or interventions to stop me from getting angrier or stop me from doing something that's going to negatively influence me or those people that
Right.
surround me. So what do we do about depression? What do we do? How do we either stop it, eliminate it, decrease it? What do we do about the depression um, if we're diagnosed with it?
I think that it's important that we, again, I always allude this as self-awareness. I think people take for granted how important and how significant that is to know yourself. And in knowing yourself, you can, learn techniques and practices to effectively decrease your episodes of depression. There's a difference of reoccurring depression, meaning it's ongoing, or it might be episode, meaning something particular happened that pushes you in a setback. An example of that, because I want to make sure we're kind of explaining it in the episode. Let's just say, for instance, you're in a relationship, you and your boyfriend break up, you have a depressive episode. You ultimately bounce back. You get back in your groove of things. You're back into it. You get into another relationship with Johnny, and then that relationship goes down, and you have another episode. And so, those type of things. It's important to acknowledge what's creating or what may be leading to that. What emotional, connections or experiences may be encountering that. When you have that type of self awareness and insight of what's causing or what's triggering those emotions, you can better offset that. The response to depression, the response to any type of mental health experience, is going to be based on the individual person. Of course, we throw out breathing techniques, we throw out, engaging yourself, interacting with other people, um, but it looks different for everyone. So you really just have to kind of know what works best for you. I'm a true believer in journaling. I believe for people who cannot articulate or put into words, or talk to other people about what they're experiencing, always write it down. I believe in that. For some people, it's just, getting out, exercising. For me, in my experiences, sometimes it's just, putting my best on, taking myself out to eat, just doing something, and being around other people, even if it means I'm by myself, just being in the present and being able to embrace the moment and the things that are happening for me. I sometimes do this thing of positive affirmations. So I'm challenging my negative thoughts every moment. What are the things that are most challenging for me? And I'm creating positive affirmations to that. Some people, it's just a playlist. I got my playlist, my songs that kind of rejuvenate my mind and just cause me to think about things. Um, Lists can go on
Yeah,
because it's just so many things that are effective for different people.
absolutely. As you were saying it, I was thinking about support system.
Yes.
Just having a great support system and depending on them, communicating with them, talking to them about what you're actually feeling. Um, Speaking of that, what can family members do, or your support system, your friends? What can they do if they see, all right, this person looks like they've been in this little mood for a little bit too long?
I think it's important. I think you kind of have to be, and it's a teeter tatter when we're talking about support, because I like that I love and encourage support, but I also like to encourage people don't become dependent on support, because at all magnitudes, sometimes support can't be what you need it to do, and we all have a different idea of what support looks like. I think when you're trying to support somebody who may be experiencing depression or any of the other symptoms that we kind of diagnosis you kind of talked about, is always just educating. You know what I'm saying? I think the idea of support is sometimes it's just educating, sometimes it's just listening. It's just seeing what that person may need, calling them up, asking them if they want to go out some places, looking up, the idea of therapists or things that, are in the community that are available to them. I think for, individuals offering to go to therapy with them, even if you don't feel like you actually need it, you know what I'm saying? Just willing to engage, talking to them about, being able to talk openly about people, exploring emotions with them. I've seen, recently where people have started doing where they write down different things, on a plate and just going and crashing the plates,
Really?
Yeah, they've been breaking them up. It's been more traditionally amongst females, but there's so much power in being able to release
Yeah.
those emotions. And I think about ultimately what that creates for a person, mentally, psychologically, for people that are visual. It does a lot in that moment to feel like you're breaking the things that have been holding you down back. So it's just, the opportunities of being able to cope with different things are so it's such a magnitude, but it just looks. I don't like to say that this is how you have to cope with depression, because to me, as an educator, I am learning that when you tell people that this is what you have to do, people don't try anything different.
Hmm.
You see what I'm saying?
Right.
They don't. They stick to this one umbrella of things, but for each and every individual, it may be different.
Right.
You know what I'm saying?
Right.
Just watching your favorite movie can put you in a different mood. There's certain moments where, if I'm struggling in an area, or anything, because I think one of the things, and I hope I'm not going too far off, but one of the things I often think is people think that because we're therapists that we're exempt from experiencing
Right.
the same diagnoses that we're talking about, and that's one of the magnitudes that we're not. I think one of the things that we didn't kind of hit on, and another element is kind of like grief. How grief and depression can go mirror to mirror when we're dealing with things, and a lot of people are not depressed; they're just impacted from grief. So it's just so many. You know how my mind gets to
Yeah.
wonder, but it's just so many magnitudes. I don't want anyone to think there's just a one shoe fits all when we're talking about how do we respond to, or what are the magnitudes of dealing with or responding to depression or any other diagnosis. It's just being able to kind of work through those mechanisms, and again having that self awareness and insight.
I'm glad you said that about grief because, again, I brought up support system, but I don't care how big your support system is. I don't care how strong it is. When you lose somebody that's been close to you, that support system is almost for naught. It was brought to me one time. Well, if I lost that person, I might lose somebody in my support system. That's gonna be a double whammy. So for different things that we're going through, we might have to use different interventions. That's why it's good to go to a professional,
Right?
so that they can look at your isolated situation, and based off of evidence based approach or interventions, they can give you some guidelines to go to. And again, like you said, everybody is different, and it's just like with cologne or perfume, right? It's gonna smell differently on different people because their body is different. So watching a movie may help one person, it may not help another person.
Right.
It's really important for you to go to therapy to kind of figure that out, and gain education, better awareness of yourself, and what you can do to cope with whatever it is that you're going through. Based off of that, how can somebody, give me your top 5 places. I haven't done this in the previous podcast, but I think I'm gonna start ending my podcast with top 5.
Okay.
Give me the top 5 places if a person wanted to seek therapy. Give me the top 5 places in their area. 5 things that they can do to find a professional in their area to help them with whatever issue they may going through. Now, it might not even necessarily be depression. Just like you said earlier, adjustment disorder. Just going through a transition, a life transition. Maybe you lost someone. Maybe it's a breakup. Maybe it's a change, a relocation. That within itself is affecting you whether we realize it or not. But anything that they're going through, what's the top 5 things or places that they can do?
I think I always like to rely on the phone a friend. I think, we have a community of platforms, social medias, that are evolving. And it's the new, it's the new Google,
Mm-hmm.
social media platform. I know that we can Google a lot of information, but the social media platform just gives you a more magnitude. I like to call it my phone a friend. So just being able to communicate and reach out to people within you, because I think it makes it more personal as well.
Mm-hmm.
If you can have somebody mention a name or drop a name and be able to give you feedback or information about that specific person or specific service provider, may make you a little bit more comfortable. You always have the ability to engage with your physician or your doctor about seeking services, and being able to acknowledge who they may connect you with. Most of the times it may be a more state agency or something of that nature, but always just remember you can always go to other providers as well. If you have insurance, because one thing you have to think about is therapy does have a cost associated with it.
Yes.
So be conscious of
It's
that.
not for free.
It's not free. So you got to be conscious of that. So you can, definitely check with your insurance providers, to make sure, which, therapists may be within your network, what your coverage may look like. There are a lot of insurance providers who, have gotten on the bandwagon and do provide mental health services, but there are others who don't. And so, you just being able to know what resources are available for you. There are, you have your Psychology Today. That's another platform that can be utilized. You have therapy for black men and then therapy for black women. Those are avenues that you can utilize as well. And so there's never a place where you can't go to find it. It may just require some effort on your part, but there's different things and avenues. And then all else fail, Google it. The
Yeah.
therapist, you know what I'm saying?
I love when you said social media though.
Yeah.
I think it's neat. I'm on Instagram.
Right.
I'm on Facebook. I'm on Twitter, and on my handles or on in my bio, I have therapists. I might have black therapists, and I change it up from time to time. But if you put those hashtags in, you may actually find me. Then you can go through my social media and see what my thoughts are and see if we connect. As I've said in previous episodes, one of the most important things when it comes down to therapy is therapy alliance.
Mm-hmm.
That relationship you have with that therapist, that agreement, that commitment that you two have together to make a change. So it's important for you to vibe with the person that you with. Dee, I appreciate you coming through, blessing me with your presence. You gonna do it again?
Definitely, most definitely. I just like to commend you for your, efforts and your put forth to just put this platform and this knowledge base out here. I think it's just important that you're engaging different people, because black therapists, all of us are different. All of our experiences are different. You know what I'm saying? And you have to find the person that's relatable to you. I think that's important. And so, like you said, just being able to connect with people, and being able to do it in the way in which you're doing it. I think just bringing that awareness to our community that it is needed. And that we are out here is just so important. So I appreciate you for that. I appreciate the opportunity to be here with you. And I definitely look forward to coming back.
Yeah. Thank you for being with us. We got to find something else that we can let you just get away with and just have your way and just talk about whatever. Once again, I'm your host, Curvin Searles. Check me out on Facebook, Instagram, and Twitter. When I say check me out on Facebook, Instagram, and Twitter, you can check me out personally. I think I'm the only one with the name Curvin Searles. I might not be. But if you want to check out Gravity Counseling Group, where I'm a therapist at, you can check out Speaking with Gravity on Instagram and Facebook. If I said something to make you think you can use therapy, seek a professional in your help with those avenues that we spoke about earlier, be it therapy for black men, Psychology Today. Call your insurance company, ask your doctor. If you need help finding one, send me a message and I'll try to point you in the right direction. For those of you that want to support Speaking with Gravity, we have a Cashapp. It's the $ the Gravity Group. Thank you to my wife. Thank you to my kids, my family, my friends that are supporting me, encouraging me to continue to do this. As I said earlier, it's totally out of my comfort zone. I'm getting a little bit more comfortable with this, but it's helping me grow as a person just doing this. Thank you to Robbie Kelly and Laverne Cinemas. Thank you to Mr. Winston. I'm going to start calling him Mr. Winston. These are the two guys that helped me with this podcast because I couldn't do it by myself. Thank y'all for taking the time to listen. You could be doing anything right now, but you chose to listen to me, and I appreciate that. Remember, I'm a therapist, but this ain't therapy. It's a podcast.
Some people
We out.
never change their mind. Everything's gonna be alright. But either way, we're gonna be just fine. Everything's gonna be alright. Even when you try to bring me down, everything's gonna be alright. You see, I'm still here. Let me adjust my crime. Everything's gonna